Hello, everybody. Welcome to today's webinar. Today, we want to talk about podiatry, foot care, DME. We're going to talk about a couple of things that changed for 2024, and we want to go over some of the routine or common coding for podiatry. I find that when we're working with a new client or group, we have several orthopedic groups that have podiatrists within their practice. There's always a lot of trouble initially with podiatry claims because the information that needs to be in that claim and the patients that would qualify for Medicare to pay for podiatry uh, can be very complicated and narrow. And so we want to talk today about those things that I see routinely, um, and talk through them and make sure that you have the appropriate information to try to avoid those denials. Let's go ahead and get started. So routine foot care in general is not covered by Medicare. And these are the things listed here that are considered routine foot care that Medicare doesn't cover. Now, there are exceptions to that, but if we have a normal patient um, and they have any of these particular procedures done, there'll be a specific reason that qualifies for Medicare to pay. Otherwise, this won't be paid. And we're going to talk about all of that today. All right, so now we're going to talk about the payable diagnosis that CMS will cover these certain foot care codes that they won't cover for a patient that doesn't have a specific condition as we're looking at. Those listed with an asterisk have other specific guidelines that we're going to talk about in just a minute. But just keep that in mind that some of these have an asterisk and some of them don't, and there is a purpose for that. So we have claims that need to have class findings identified as a modifier on the claim. And as you can see, there are three kinds of class findings. There's class A, B, and C. And for A, it is the non-traumatic amputation of the foot. The class B gets a little bit more complicated in the fact that the patient does not have a pulse in the posterior tibial area. And they also have trophic changes, whether it be hair growth, nail changes, pigmentary changes, skin texture, skin color. Three of those are required, and they are also don't have a torsalis medius pulse either. And then the class C findings is, claudication, temperature changes, edema, and the burning of feet. So we can identify patients that have these particular conditions or signs and symptoms of their condition, and we would then give them a classification based on their particular problems. Now, the way that we report that to Medicare is to use a modifier. And you can see here that there are three modifiers. A and B are relatively easy, but as you can see with the Q9, you need one Class B and two Class C findings to identify them as a Q9. So that's your very complicated patients. All right, one of the common surgeries that podiatrists perform are bunionectomies, and we have a bunion or a bunionette. The bunion being on the first toe, a bunionette would be on the small toe at the metatarsal phalangeal joint. So while they're very similar in what they look like or what they do, there is a bunionette because it's smaller and on the little toe where the bunion is on your big toe. So we have both of these.